Earlier this year, I recorded a video. The focus was on interviewing colleagues and friends from the LGBTI community in Zambia. It questions the accessibility of health-related services for those in need. The video unpacked various offshoots of mental health illness, which includes a wide range of ailments such as acute stress, post-traumatic stress, bipolar, anxiety, attention deficit hyperactive disorder, depression, and schizophrenia. During this process, it occurred to me that many members of the LGBTI community suffer from anxiety or panic attack. They have felt it, they can describe it clearly, but they do not know the medical term for it. Even more alarming is that they find it hard asking for help. Telling someone about their experience is just not something that they are comfortable doing. This is often because their issues are rooted in their sexual orientation or gender identity. When prompted about their awareness of institutions that provided mental health support that is LGBTI tailored, they were not too sure. So talking about their mental health issues remains a challenge as it leaves them vulnerable to stigma with no proper medical support to manage it. Most of the time they keep things inside, resorting to alcohol and drug abuse, which in the end cannot address the actual issues. LGBTI plus humans suffering from mental health issues want to get support. The challenge is that they do not have information on facilities and individuals that are specialized in providing support to their ailments. The issue is not that they do not go out searching for information or support, but the relevant facilities lack visibility, especially for those who are desperate for these services. During my daily interaction with my colleagues from the health fraternity, I took it upon myself to inquire about facilities and professionals that could provide tailor-made LGBTI health mental support. One of the things that surprised me was that Chinama, yes, the very Chinama, an institution based in Lusaka that has always been associated with mentally unstable persons as qualified professionals. They could even be hired privately to provide services to sufferers of mental health illness. The hospital provides support that includes psychosocial counseling and medicated services for patients with bipolar disorder, depression, anxiety or panic attacks, stress, and many other illnesses. Another organization that can provide psychosocial counseling, especially for LGBTI community members struggling with self-acceptance, is the Volunteers Welfare for Community-Based Care of Zambia, VOAZA in short. The organization has experienced psychosocial counselors who offer support on a voluntary basis. Its counseling services are also free. Having said that, I am appealing to all LGBTI community members that suffer from mental health illness to contact or visit these institutions. It's also worth noting that the Open Doors Project has a memorandum of understanding with all district health offices under the Ministry of Health. So please visit any government institution and just mention that you are from the Open Doors Project, and they will direct you to respective individuals that can assist with any mental health related illnesses.